Hello, Patricia. How are you?
I'm well, thank you. How are you, Diane?
I'm good, thank you. And thank you very much for joining us today. I have a series of questions to ask you. My first question is just about how are you looking after yourself and your teams in these quite challenging times?
I'm a keen runner, so I enjoy keeping fit and I run every day. And that gives me space to think, download, and just relax. I love being outside. And I'm very fortunate in that I have a garden. In terms of looking after staff, and many of our staff have either been deployed to the front line, so if they have a clinical background, or indeed if they don't, many of them have been working alongside frontline services. And for those who haven't, they've been working remotely from home on keeping everything going in the background. And I'm very fortunate to have a fantastic bunch of staff across all three CCGs. So the health and wellbeing message to members of staff was really important in terms of downtime, in terms of connecting with each other. Many of our staff are, over 90% of the staff within the three CCGs are local patients and residents themselves. And so they were reaching out within their own communities to be supported and support others. And it was phenomenal, the amount of support that we had from our local communities as well. And that is continuing. Rather than changing services, actually, we haven't commissioned new services or closed services down, but we've connected the services in a different way. And technology, like we're using now, has been a fundamental part of that. So before COVID, 80% of consultations with a general practitioner or other community clinician would have been done face-to-face, people turning up at surgeries, being seen by their GP or their community nurse. And now 80% of consultations are done digitally, either over the phone or through these kind of mediums. And I think before, when we tried to look at digital technology, there was a little bit of reticence, both clinically from GPs and also from members of the public who generally, like to see their GP. We're a sociable healthcare organisation that deals with and likes to be with people. So, but I've been overwhelmed with how both clinicians and patients have embraced that. And in fact, for both parties, both patients and GPs, that has made things a lot easier in terms of, GPs are still seeing patients in terms of face-to-face consultations. For people who lead busy lives or are at work or whatever, that's been far more convenient from their perspective, and they've managed to get the treatment that they've needed far quicker. So in actual fact, the digital technology that's been speeded up through this process has really helped primary care access. I think there's been a kind of view that you can only use technology for a small sector of the population, when in actual fact, quite a lot of our population are pretty digital savvy, and even when they aren't, they've engaged with the digital technology really, really well. We are one health service. It's called a national health service for a reason, and I think we rediscovered what that really meant through COVID. It didn't matter and doesn't matter, and it continues to be the case, what badge you're wearing. People embraced the fact of working together and didn't see themselves as operating in isolation, but really embraced what it meant to be part of a national health service. The response from our local authorities, police, fire, and our wider communities, voluntary sector communities, it wasn't just the health service, there was almost like a national care response of all of those people working together. So that's the thing that I'm most proud of, is that the way people come together. So if there is anything that comes out of this, again, it's the sort of readdressing what's important. You'll know that our GPs had to vote for the merger, and they did so across all three CCGs unanimously. It was an overwhelming response. And It's not just about an administrative change and taking some of the bureaucracy out. They also feel very strongly about working together as a single CCG will allow us to focus at scale on reduction of health inequalities, removing unwarranted clinical variation, so that if you're a resident in Milton Keynes or a resident in Bedfordshire or a resident in Luton, you should be able to have access to the same kind of care and treatment. We were all already focused with local authorities and voluntary sector on integrating services. And there's much debate, as you know, about how you integrate services and when you integrate them. And of course, when COVID hit, we suddenly realised how to integrate services because we had to. So I think that's the learning, is making integration happen in a very practical way for individuals, rather than thinking about what the organisational barriers are. We've worked together because we have to, but it's also illuminated some of the very deep-seated health inequalities and funding issues, I think, across the system. And what is clear, and I'm going to say this in support of our local authorities and voluntary sector, is that there is a need to recognise the importance in social care funding going forward, because if social care and the local authorities fall over, then that has a huge, profound effect directly on healthcare services. I think the other positive learning, really important learning, has been the important role and function that the voluntary sector has played. And we know that the voluntary sector has been hugely hit through COVID, because a lot of voluntary sector funding comes from charitable donations and fundraising events like running and various things that have had to stop during this COVID period. But they have a very fundamental role to play in the removal of isolation, bringing people together, and very low cost ways of meeting people's needs that keep them independent. And so part of that solution, I think, around sustainable services going forward has got to include the voluntary sector as well. And I think it's made us as a health and social care system think a little bit more openly about that in a more concrete way. So I think that's been an important learning piece as well.
Thank you, Patricia, for talking to me today. It's really nice to hear from you. And all I can say is stay safe and stay well.
You too. Thank you for giving me this opportunity to talk to you as well. Thank you.
My pleasure. Thank you.
Take care.